I'm Seth Berkowitz. I'm delighted and truly honored to accept this award as an outstanding junior investigator. Though not the reason we do this work, peer recognition certainly means a lot, and it is especially welcome to have some good news after what has been a very hard year for so many of us. This is an individual award, but good science is not done individually. It is done in teams, and so there is no way this could have happened if it hadn't been for a tremendous amount of support I've received over the years, which means y'all are in for a long list of thank yous. I'd like to start by thanking my mentors over the past 10 years, Mitch Feldman, Irma Malasarkar, and Hilary Seligman at UCSF, Danny Singer, Nancy Rigatti, Josh Metley, James Miggs, Steve Atlas, and Deborah Wexler at MGH, Nitish Chowdhury at the Brigham, and Darren DeWalt and Giselle Corby-Smith at UNC. Y'all taught me how to do rigorous research that helps to answer important questions and push me to do work I was proud of. I would also like to thank my general medicine CoFellows who were instrumental in helping me think about the areas I wanted to investigate and shape my career goals, including Sam Edwards, Mark LaRochelle, Rose Kokoza, Lindana Morast, Gabe Fabreau, John Maffei, and Rebecca Machuras. I'd like to thank close colleagues and collaborators at UNC and other institutions, including Tom Kaiserling, Crystal Wiley-Sene, Avik Chatterjee, Travis Baggett, Sridharan Raghavan, Gina Cruz, Athene Venkataramani, and Sanjay Basu. Thanks to my parents, Ruth and Scott Berkowitz, and thank you to my wife, Catherine Aragon, for your support, continuing to put up with me, and for mostly living up to your wedding vow to find my jokes funnier each time that you hear them. I also want to thank the selection committee and the other SGIM junior investigators considered for this award who, without knowing who they are specifically, I know are producing outstanding and deserving research as I see it at the SGIM meeting each year. When thinking about the support I've received, I'd be remiss not to think about the advantages I've had that have helped put me in this position. These include advantages related to my ethnicity, gender, and class. My work primarily focuses on issues related to health-related social needs, such as food insecurity, along with income inequality and health equity. From this, I know that our health and our chances to succeed in life are determined by systems that are beyond our control and often deeply unfair. Racism, gender discrimination, and economic exploitation structure our lives in ways that none of us, especially not the beneficiaries, should be comfortable with. The period in which I was engaged in the work this award recognizes coincided with the period in which Catherine and I had our children. Becoming a parent is an occasion to reflect on the world we want our children to live in. It's also maybe a time when we were able to see what our parents did for us in a new light and think about how the work we might do reflects the values we were raised in and the example we want to set. Since the work this award recognizes focuses on health equity, which is very much an unfinished project, I don't view this as a laurel to rest on. Instead, I view receiving this award as accepting an obligation to use my position to help others and to use my research to work towards a more equitable society. Sometimes that will be as a principal investigator, sometimes as a colleague, sometimes as a mentor, sometimes as an ally, and sometimes as an advocate for others' work. The best work we do is done in teams, and this work in particular needs a really big team. My promise here is to be a good team member, and my challenge for all of us is to team up and work to create a healthcare system and a political economy that is more fair for our patients, our community, our country, and our world. Thank you.